Bloodborne pathogen certification. After completion of this session, you will be able to identify bloodborne pathogens, understand how diseases are transmitted, determine your risk of exposure, protect yourself from exposure through prevention, respond appropriately if exposed, and understand your right to medical evaluations. Bloodborne pathogens are microorganisms present in human blood that can cause disease. The primary workplace pathogens are HIV, human immunodeficiency virus, HBV, hepatitis B virus, and HCV, hepatitis C virus. HIV leads to AIDS. It attacks and depletes the human immune system. There is currently no cure for AIDS. HBV is a serious liver infection caused by the hepatitis B virus. HBV can survive outside of the body and can be transmitted through dried blood. If exposure occurs, OSHA recommends receiving a hepatitis B vaccine within 24 hours and no later than 7 days after the exposure incident. HCV is the most common chronic bloodborne infection. Symptoms can take years to manifest, and treatment is marginally effective. Transmission of bloodborne pathogens can be from contaminated sharp objects, such as broken glass. Transmission can be through broken skin, including rashes, and through the eyes, mouth, or nose. There are common routes of exposure. Two likely routes of exposure that we may experience as couriers is during the transport of used medical equipment or transporting human specimens. If you have any questions about bloodborne pathogens, please speak with your administrator at the end of this presentation. Bloodborne pathogen law requires a written exposure control plan, or ECP, engineering and work practice controls, personal protective equipment, or PPE, training, medical surveillance, free hepatitis B vaccination, signs and labels, and other equipment and procedures as required by the law. The exposure control plan identifies potential exposure incidents, outlines certification requirements, and explains how to decontaminate equipment and surfaces. It also explains how biohazard waste is to be handled. This is a copy of the Priority Dispatch Exposure Control Plan. Use of personal protective equipment is to ensure you are taking universal precautions to create a barrier between you and any potential exposure risk. Universal precaution is treating all bodily fluids as if they are infected. Gloves are ideal. However, if not available, plastic bags or any barrier you can create between you and the bodily fluid is recommended. Safe practices. No eating, drinking, cigarettes, cosmetics, or other personal items should be where there is a possibility of exposure to blood. Do not place or store food in any area where blood or bodily fluids may be present. The next few slides cover decontamination and the disposal of biohazard waste. Decontamination involving sharp objects. Remove glass and other sharp materials using a brush and dustpan or tongs. Do not use your hands. Use paper or absorbent towels to soak up the residual liquids. Disinfect all surfaces and allow time to dry before using again. There are two types of biohazard waste, regulated and unregulated. An example of regulated waste is a sharps container found in hospitals or in doctors' offices. All regulated waste must be labeled with the universal biohazard symbol. Unregulated waste is blood or other potentially infectious materials that can be absorbed completely in the material used to remove the liquid. To dispose of unregulated waste, double bag all of the material related to the incident, seal, and throw it away. If you come across a situation where regulated waste disposal is required, contact Priority Dispatch immediately for proper disposal instructions. Labels are typically not required for unregulated waste. In the event of an exposure incident, wash cuts and skin thoroughly. Rinse your nose and mouth and flush eyes with clean water or a sterile solution. Clean all contaminated surfaces. Report all incidents to priority dispatch. If you have an exposure event, post-exposure evaluation is available to you. You have the right to a confidential medical evaluation, to document the route of exposure and identify the source individual, have the source individual's blood tested, and the results of the test will be provided both to the source and exposed individuals. You also have the right to a hepatitis B vaccination. In the event of an exposure incident, priority dispatch will cover the cost of the vaccination. OSHA does recommend that you receive the vaccination within 24 hours and not more than 7 days of the exposure incident. You also reserve the right to decline the vaccination. Key points to remember. Bloodborne pathogens can cause fatal disease. Be aware of exposure risks. Take universal precautions. Use personal protective equipment and decontaminate yourself and equipment. Understand and follow exposure incident procedures. Report exposure incidents to priority dispatch.